New Year quickly approaching. Doctors have 10 recommendations to help you improve your health in 2019. What's more important than your health?
Nothing.
Nothing. Dr. Chaffoo is joining us now to tell us about 5 of those right now. So we're breaking them down because a lot of good information. Doctor,
Yes.
good morning.
Good morning.
We're going to count them down. Okay, so we're going to get started right here at number 10. Learn your risk for type 2 diabetes. Why is that important?
It's so important, Raoul, because about 3 million people in the United States each year get type 2 diabetes, and many people have no symptoms at all until their blood sugar is literally out of control.
Oh my.
So you really want to know, if you do have symptoms, the things that you want to look out for are increased thirst, increased urination, increased hunger, fatigue, blurry vision. Those may all be signs that you have a condition called pre-diabetes. There is a website you can go to, doihaveprediabetes.org, to look at symptoms, but it's important to also stress, Raoul, that many people have no symptoms before getting diabetes, so it's important to stay in touch with your family doctor.
I know people, the type 1 and the type 2. For the type 2, is it genetic? Is it diet?
It's thought to be perhaps more diet related. It's either a reduced production of insulin or increased insulin resistance. So it's something you get as you're older. Okay,
number 9, this is important. Be more physically active, and we're not talking get out and run a marathon.
Correct.
Just get out and do anything.
Get out and get some exercise. Recommendations are for 150 minutes a week, moderate vigorous activity, and about 75 minutes of vigorous activity. And the reason for that is that obesity is a huge health problem throughout the world. A little bit more common in women than men, but if you can imagine that within the world there are about 600 million people who are considered to be obese. That's with a body mass index or a BMI of above 30 or above. And that's like double the population of the United States. So it's a huge health issue. So if we could simply get more active, watch what we eat, we can certainly make this less of a health epidemic.
150 minutes a week is not that much. 7
really
days,
isn't.
you do that, you go for a 20-minute walk around your neighborhood. That's pretty good. That's
very good.
Know your blood pressure numbers. I go to my mother-in-law's house all the time, and she has a machine, and I always try it just for fun.
No, it's a great idea, to getting in the range, and as you know, the actual numbers vary depending upon your age and other associated factors. But we know that many people with uncontrolled hypertension are completely asymptomatic. High blood pressure is associated with strokes, increased risk of heart disease, heart attacks, kidney damage, renal insufficiency. So there are many serious implications of untreated hypertension.
You say asymptomatic. A lot of people say this comes out of nowhere, but tracking your blood pressure numbers can maybe help in figuring
Treat it
some
early
of this out.
on. Get on medications early on once you start noticing your blood pressure is elevated.
Number 7. I feel like Casey Kasem. Number 7 on the countdown. Reduce your intake of processed foods. Oh, last 3 months, Doc,
Raoul, I
have almost cut all that out.
They're good for you.
Yeah.
Because processed foods, as we know, have high contents of salt, high contents of sugar, both of which are, too much sugar tends to lead more to pre-diabetic conditions, and too much salt affects you if you affects your blood pressure. So also there are numbers of chemicals and additives that are put into these processed foods, from colorings to taste to texture, which we really don't need, or very hard to digest, and we don't know the health implications.
Yeah, I mean, it's amazing that so many of these processed foods still have. I went to my doctor for a physical. He said you got to control and cut down your sodium and your sugar. And then you look at every single processed thing out there, and it's all sodium.
Designed that way to addict us, for sure.
Oh my God.
Yes.
Doc, get on that.
Okay.
Take care of these people. Number 6, take antibiotics exactly as prescribed when your doctor gives them to you. Otherwise, what can happen?
Yes, and the thing is to take it for yourself and not for other people, because we've seen increased, what are called superbugs, increased resistant infections, resistant organism causing infections. And also the other issue is we have normal flora, bacteria within our GI tract, and long-term antibiotic use, Raoul, can alter that flora, can make us develop organisms that can overgrow in the GI tract, something called C. diff, which can be a life-threatening infection. We're also seeing it harder to treat. It's very simple infections that we've had in the past, like meningitis, pneumonia, is because people are taking antibiotics for the wrong reason. They don't work for the flu, they don't work for viruses or colds. Those are not treated with antibiotics, as we know, are for bacterial infections. So don't treat yourself, and don't give the antibiotics to a friend or a family member.
That's very important, because people don't respect these antibiotics and they think it should pop them. Dr. Chaffoo, you're going to be back in our next hour with our top 5 recommendations. You're not going to miss that. These are very, very helpful going into the new year. Doctor, thank you. We'll see you in a little bit.
Okay.
All right.
Time now for your